Hi to all, this lecture is about the skeletal system. Now, let us discuss first the functions of the bone. Our bones perform several important body functions. One is to provide internal framework and body structure. Remember that without the bones to form our internal skeleton, it's as if we would creep along the ground. Wala tayong definite shape or body form. Second is it supports the body and cradles internal organs. Examples are bones of the legs. They act as pillars to support our body trunk, lalo na pag tayo ay tumatayo. The rib cage, it supports the thoracic wall. Third, bones protect soft body organs. Example are the bones of the skull. They enclose our brain. Another, the vertebra, they surround our spinal cord. Also, the rib cage, it helps protect the vital organs inside the thorax. Fourth, they allow movement with the skeletal muscles attached to the bones by the tendons. They use the bones as levers to move the body and its part. Fifth, it stores nutrients, fats. They are stored inside marrows. Also, the minerals calcium and phosphorus in our bones. But remember that calcium must also be present in the blood for nerve impulse, for muscle contraction, and for blood clotting. And the bones also assist in blood cell formation. This is hematopoiesis happening in the marrow also. What now are the bone cells? Osteocytes are the mature bone cells. They are found in the matrix of the bone. Second are osteoblasts. They are the bone-forming cells. They are for bone formation from the name of the description of the cell, or ossification, also for bone growth, especially in children. Osteoclasts are the bone-destroying cells. They are responsible for bone remodeling, especially when bones are damaged. Let us now discuss the major categories of bones. There is a total of 206 bones in our body. The eggshell skeleton are 80 bones. They form the longitudinal axis of our body. These are the skull, the vertebral column, and the thoracic cage or the rib cage. While the appendicular skeleton, 126 of them, they are attached to the eggshell bone. So, merong kanang side, may kaliwang side. Ang appendicular skeleton, the shoulder girdle, the upper limbs, the pelvic girdle, and the lower limbs. These are skeleton, the bone. So, you have to memorize the names of the bones. Those in blue are the eggshell ones, and those in red are the appendicular skeleton. Now, what are the bone tissues? The bone tissues are a combination of the bone cells. And again, in the matrix are osteocytes, which are the bone cells. Compact bone and spongy bone are the types of bones in bone tissues. The compact bone is dense. It looks smooth and homogeneous, while the spongy bone has a spiky, open appearance like a sponge. So in the photo, we'll see that the compact bone is hard. The spongy bone is somehow soft. Another classification of bones are bones according to shape. We have the long bones, the short bones, the flat bones, and the irregular bones. Let us now try to discuss them one by one. The long bones are typically longer than they are wide, and as a rule, the bones have a shaft and enlarged ends. In the photo, you can see that the shaft is named diaphysis, while the ends are epiphysis, the proximal and the distal epiphysis. The enlarged bone is the left femur. So the upper epiphysis is proximal and the lower epiphysis is distal. All bones of the limbs except the patella and the wrist and the ankle bones are long bones. And mostly, no, ang mga long bones na ito, they are compact bones in the epiphysis, and they are spongy bones in the diaphysis. In the photo also, you will see there an epiphyseal line. The epiphyseal lines are found in adults, and they are remnants of the epiphyseal plate. And these epiphyseal plates are responsible for elongation of long bones in children. The bones of the wrist and ankle are also short bones. So for the hands, we have the radius, ulna, carpal, metacarpal, and phalanges. But the carpals, hindi siya long bone, it's a short bone. Sa foot naman, we have the tibia, fibula, tarsals, metatarsals, and phalanges. Again, the tarsals, not a long bone, but considered a short bone. The short bones are the tarsals of the foot and the carpals of the hand. Generally, they are cube-shaped and they contain mostly spongy bone with an outer layer of compact bone. Sesamoid bones, on the other hand, they form within tendons. They are a special type of short bone, and the best known example is the patella. Third are flat bones. They are thin, flattened, and usually curved. They have two thin layers, compact bone, nasa-sandwich niya yung layer of spongy bone between them. Most bones of the skull, the ribs, and the sternum are flat bones. And if we look at these bones, they usually protect internal organs. The last are the irregular bones, and they are bones that do not fit any of the preceding categories we have discussed, and they are irregular in shape. Like short bones, they are mainly spongy bone, and there's an outer layer of compact bone. The vertebra, which make up the spinal column as shown in the photo, fall into this group, and see how irregular the shape is. The ossicles are included in the irregular bones, and the ossicles are the ears, the ear bones. They are the smallest bones found in our body. Mostly the bones are for movement, but here the ear bones, which are the ossicles composed of malleus, incus, and stapes, are responsible for hearing. They help in the mechanical vibration of sound as it enters the ear to be interpreted by the brain. So this will be further discussed in the special senses. Let us now discuss the other structures of the bones. So again, we have recalled that the ends of a long bone are the epiphysis and the shaft is the diaphysis. The diaphysis is covered by periosteum. It's a fibrous connective tissue, while the epiphysis is covered by cartilages. They provide a smooth surface to prevent friction when the bone ends move, especially kapag merong mga joint movement, the ends of the bones move together. And to prevent friction, nababalutan siya ng mga cartilages, which is rubbery. In infants, the cavity of the shaft of long bone is the red marrow, and that produces blood cells. Until the age of 6 and 7, function yon in children. Pero, nare-replace siya ng yellow marrow sa adult. And in the yellow marrow, in the photo, you will see nagiging fat storage na siya. Sa adults, ang red marrow nako-confine na lang sa spongy bone, especially the spongy bones found in the axial bones, the hips, and yung epiphysis ng long bones such as humerus and femur. So again, red marrow produces blood. We'll not go through the microscopic anatomy anymore, and we just focus on those more significant to know when it comes to nursing especially. So let us proceed now to the major categories of bones. We have the axial skeleton again. We have the appendicular skeleton, and together it makes up the 206 bones in our body. The skull is composed of two sets of bones. First is the cranium, and second are the facial bones. The cranium encloses and protects the brain, while the facial bones form a cradle for the eyes that is open to the anterior, and also they allow facial muscles to show our feelings through smiling, frowning, and the like. Now, going back to the cranium. The cranium is composed of 8 large flat bones. Except for 2 sets of pair bones, the parietal and the temporal are all single bones. So what are those 8 bones? We have 1 frontal, 2 parietal, 2 temporal, 1 occipital, 1 sphenoid, and 1 ethmoid. Total of 8 bones of the cranium. The facial bones, on the other hand, it has 14 bones. It makes up the face, no? Yung 12, paired siya. Mandible and vomer lang ang single. So we have the 2 maxilla, right and left, 2 palatine, right and left, 2 zygomatic, 2 lacrimal, 2 nasal, 1 vomer, 2 inferior nasal conchae, 1 mandible. Lahat ng skull bones, they are joined together by sutures, which are interlocking. Immovable ito, except yung sa mandible or the jawbone. And then, attached siya to the rest of the skull by a freely movable joint. So please be familiar with the names of these bones. The vertebral column is the axial support of the body, extending from the skull to the pelvis. The skull is supported by the vertebral column, while the pelvis, it is where vertebral column transmits the weight of the body going to the lower limbs. Running through the central cavity also of the vertebral column is the delicate spinal cord, which it surrounds and protects. The spine is formed from 26 irregular bones, and they are connected and reinforced by ligaments in between in such a way na nagiging flexible at nagkakaroon ng curve structure yung ating vertebral column. You will see in the photo that the terms convex and concave are there. The terms refer to the curvature of the posterior aspect of the vertebral column. Pag sinabing convex, siya ay primary curvature, which means present na yung curve na yan when born. The concave naman is a secondary curvature, which means it develops after birth. Looking again at the photo of the vertebral column, the cervical column is concave, and the C1 to C7 siya. The thoracic is convex, T1 to T12. Lumbar is concave again, L1 to L5. Sacrum is convex. It is one vertebra na nag-fuse from 5. And coccyx, 4 fuse as 1. Also, individual vertebrae are separated by fibrocartilages called intervertebral discs. These cushion the vertebrae to absorb shock and allow spine flexibility. There are 2 different types of discs in the spinal column, and those are the thin and the thick discs. Pag thin disc o manipis lang, they allow great flexibility. Pero yung mga thick discs between the lumbar area particularly, they reduce flexibility. In a young person, these discs have a high water content, spongy and compressible siya, kaya mas flexible sila. Pero as a person ages, yung water content ng disc maaring mag-decrease. So harder ito and less compressible. Nagkakaroon minsan ng problem dito, herniated disc. Usually sila yung mga older people kasi nga less water content doon sa discs, or someone na subjected to exceptional twisting forces, yung vertebral column. These are abnormal spinal curvatures. Scoliosis is S, or lateral curvature of the spine. It could be congenital or acquired. Depende rin ang management dito dun sa severity ng pagkaka-curve. Sometimes, yung mga mild lang needs no treatment, just proper body mechanics and positioning. Minsan naman, kailangan ng mga braces na external, no? Or surgery for severe cases, especially those na nai-impede na yung breathing kasi naiipit ng spinal curvature ang lungs. The second is kyphosis. It's the backward curvature of the spine. So yung mga older women, especially those with osteoporosis, can develop a backward curvature, no, lalo na kapag sila ay nagmenopause, no, yung kakulangan din sa estrogen leading to lesser calcium, vitamin D, nagkakaroon ng less bone mass leading to kyphosis or osteoporosis. Third is lordosis, or the forward curvature of the spine. It is usually normal in toddlers and also in pregnant women na malaki na yung uterus, lalo na nasa third trimester. Now, the sternum, the thoracic vertebra, and the ribs, they make up the bony thorax. Ang bony thorax, tinatawag din siyang thoracic cage or rib cage because it forms a protective cage of slender bones and cartilages around the organs of the cavity. And ano yung mga organs na nasa loob niya? The heart, the lungs, and the major blood vessels. So, the sternum is composed of 3 bones. We have the manubrium, the body, and the xiphoid process. Siya din yung breastbone, no? And we use this bone, no? It's this significant bone is the bone na kinakapa natin, especially when we insert nasogastric tubes or orogastric tubes in patients. Kasi na-estimate kung gaano kalayo yung tube na ipapasok na atin going to the stomach. Also, this sternum, particularly the xiphoid process, yan yung kinakapang area when we do chest compressions kapag nagsi-CPR. Next, we have the ribs. The ribs, no, may true ribs, may false ribs. Ribs 1 to 7 are true ribs, while ribs 8 to 12 are false ribs. So, yung ribs, they occur in pairs. True ribs siya kasi bawat isang pair merong isang connection sa sternum. Pero yung false ribs, yung mga yan, isa lang yung connection nila. Nagba-branch out lang, pero isa lang yung direct connection nila doon sa sternum. The ribs 11 to 12 are also floating ribs kasi wala siyang connection, no, doon sa sternum. Pero false ribs din sila. Next, we have the intercostal spaces, no? Yung intercostal spaces, they are the spaces between the ribs. They are filled with intercostal muscles. At importante yon sa pag-aid ng breathing. The shoulder girdle or the pectoral girdle consists of two bones. Ito yung right and left, clavicle and scapula. This is a very light bone because it allows the upper limb exceptionally free of movement. However, itong exceptional ability na ito to be flexible also has a drawback because the shoulder girdle is very easily dislocated. When you say dislocation, it happens when a bone is forced out of its normal position in the joint cavity. The upper limbs are 30 separate bones from the skeletal framework, no? And we have the right and the left. Humerus, radius, ulna, 8 carpals, 5 metacarpals, and 14 phalanges of the hand sa right upper limb. And all in all, in layman's term, this includes the arm, the forearm, and the hands. Pelvic girdle. The pelvic girdle is formed by two bones. Ito yung coxal or the hip bones and also the sacrum. Together with the coccyx, ang tawag sa kanya pelvis. So kapag ang tinutukoy natin ay yung hip bones lang at yung sacrum, pelvic girdle yon. Pero kapag hip bones, sacrum, and coccyx, ito yung pelvis. Now, note that the terms are slightly different. And the bones of this pelvic girdle are really large and heavy. Bearing weight is its most important function kasi kinikerry niya yung total weight of the upper body. Nakarest yon sa pelvis. Also, yung reproductive organs, urinary, the bladder, and parts of the large intestine lie within and are protected by the pelvis. Sa babae, significant din ito because the dimensions of the pelvis are measured. Importante yon dahil dapat large enough yung kanyang opening, entrance, and exit to allow an infant's head to pass during vaginal childbirth. Head kasi yung pinakamalaking structure ng fetus na magpapass through dito, so dapat magkakasya yung head. If in case hindi kasya yung head, no, in such a way na impossible ang vaginal birth, the woman might undergo cesarean section delivery. Ang posibleng dahilan, malaki yung ulo ng baby, pero sakto naman yung pelvis ni mommy or the other way around. Maliit yung pelvis ni mommy, pero sakto naman yung ulo or normal naman yung size ng ulo ng baby. Yun yung cephalopelvic disproportion or CPD. Another na significant sa women's pelvis is yung symphysis pubis. The symphysis pubis assists us nurses to measure the fundic height. Pag sinabing fundic height, you are measuring or estimating the fetal growth. Kasi yung uterus nakatago dyan sa symphysis pubis if you're not pregnant. But if you become pregnant, the uterus rises out of the pelvis during pregnancy. So pag lumalaki na ang uterus ng babae, dun sa pubis siya nag-uumpisa. Symphysis pubis. So dyan nagmumula yung pagsusukat para ma-measure kung gaano na kalaki yung uterus ng babae at na-estimate din yung laki ng fetus sa loob. Usually, the uterus rises out of the pelvis by 12 weeks of pregnancy. So, doon nag-uumpisang pwedeng i-measure ang fundic height. The bones of the lower limb are the femur, patella, fibula, tibia, 7 tarsals, 5 metatarsals, and 14 phalanges, all on the one side. There's another side, so both right and left. These lower limbs carry our total body weight, especially when we are erect. When we stand, when we walk, when we hop, when we jump, these are the gross motor movements or the large body movements. Hence, hindi siya surprising that these bones, which form the three segments of the lower limb, no? In layman's term, the leg, the thigh, and the foot, they are much thicker and stronger than the other bones because they carry the weight of our body. Let us now discuss the supporting structures of the skeletal system. We have the joints, cartilages, ligaments, tendons, and bursa. The joints are places of union between two or more bones. Dalawa ang function niya. They hold the bones securely together and they give the rigid skeleton mobility, with only one exception, which is the hyoid bone of the neck. Lahat ng bone in the body, they form a joint with at least one other bone. Joints are also called articulations, and they are sites, again, where two or more bones meet. Pag nag-unite yung dalawang bone, joint ang place of union nila. Let us discuss the classification of joints by the function. So pag sinabing functional classification, it's on the amount of movement the joint allows. Synarthrosis, no movement. Amphiarthrosis, slight movement. And diarthrosis, they are the freely movable joints. So in the photo, let's say for example, yung skull. Diba? Kombinasyon yan ng pinagdikit-dikit na frontal, parietal, temporal. So yung union ng mga bones na yan, which do not move, are synarthrosis. Ang amphiarthrosis naman, yung sa ribs, vertebra, no? Because they are slightly movable. Nabebend siya, pero hindi siya totally nafo-fold. On the other hand, yung diarthrosis sa elbow, sa hips, they are freely movable joints. Maraming movement ang pwedeng gawin sa kanya. Another classification of joints are by structure. One are fibrous joints. They are made up of fibers, and these are the synarthrosis or the joints with no movement. Second are cartilaginous joints containing cartilages. These are the amphiarthrosis, which are slightly movable. But the amphiarthrosis are also made up of fibrous materials as well. Third are the synovial joints. And these synovial joints are the freely movable joints because they contain synovial fluid. It is very important to prevent friction, especially when the freely movable joints move. So the diarthrosis or the synovial joints are the plain joints. They can be found in the wrist. The hinge, they can be found in elbows, ankle, and the phalanges. The pivot or the pivot synovial joints are those in the radius and ulna. The condylar are found in the knuckles. Saddle are those joints in the thumb, and the ball and socket joints are those joints found in the shoulder and the hips. So again, here's a summary of the joint classes, whether they are fibrous, cartilaginous, or synovial joints. Next are cartilages. In the photo, you will see where a cartilage is. It covers the ends of the bones to form the joint. So, ang cartilage para siyang rubber. They resist forces of tension and compression with considerable resiliency. Maraming nag-a-assist sa mga movable joints. One, yung synovial joints nga, di ba? May synovial fluid kasi freely movable to prevent friction. Another is cartilage. It is semi-opaque, it's bluish, white, or gray, and meron siyang limited nerve and blood supply. Third are the ligaments. They are bands of tough, elastic tissue joints, as shown in the photo. Again, they connect bone to bone, they give joints support, and they limit movement. We have ligaments around our knees, our ankles, our elbows, and our shoulders. And whenever there is stretching or tearing of the ligaments, it can make our joints unstable. Fourth are tendons. It's a fibrous connective tissue which attaches muscle to bone. Its main purpose is to help move the bone kasi even if a bone is there, bones cannot move if a muscle is not attached to it. Because when muscles contract, that's when the bone can move. And again, tendon ang nag-a-attach sa kanilang dalawa. A sprain is shown in the photo below, and a sprain results when the ligaments or tendons reinforcing a joint are damaged, posibleng dahil merong excessive stretching o kaya torn away from the bone. Both tendons and ligaments are cords of dense fibrous connective tissue, pero meron silang poor blood supply. Kaya pag na-strain or na-sprain ng isang tao, nag-heal siya slowly and they can be extremely painful. Next is bursa. Bursa is a small sac of connective tissue lined with synovial membrane that produces synovial fluid. It's again commonly located at joints to prevent friction and relieve pressure where one body part moves on another. So kanina na-discuss natin yung synovial joints because they have a synovial membrane na merong synovial fluid. They are not strictly part of joints, but they are often found closely associated with them. So again, essentially mga bags of lubricants sila. They prevent friction, they help cushion, they act like ball bearings para wala nga friction between adjacent structures, lalo na pag may joint activity or movement. Pwedeng ma-infect ang bursa or pwede siyang ma-inflame. Ang tawag doon, bursitis. So here we see in letter A, may bursa sa head of humerus and acromion process, between patella and skin on B, head of femur and skin on C, and the olecranon process and skin on D. So, ang mga bursa na ito are the ones providing synovial fluid for the freely movable joints, yung mga diarthroses or the synovial joints. We have mentioned some homeostatic imbalances previously, but let us focus on 3 disorders for now: fracture, rickets, and arthritis. Fracture is any break in the continuity of bones. Bone is one of the hardest materials in the body, and although relatively light siya, meron siyang remarkable ability to resist tension and other forces acting on it. It's because calcium salts that are deposited in the matrix give bone its hardness, and it resists compression. Yung organic parts like yung collagen fibers, they provide for bones flexibility and great tensile strength, or ito yung ability niya to be stretched without breaking. But sometimes, bones do break, especially ang mga long bones. And if there is a break in the continuity of bone, we call it fracture, close or simple, if the bone breaks but doesn't penetrate the skin. If it is an open or compound fracture, broken bone ends penetrate the skin. Treatment for fractures are by reduction, which is realignment of broken bone ends. So pag sinabing reduction, papantayin mo lang yung nag-break the bone. Okay? To realign, physician's hand kapag close reduction. Or surgery naman kung kailangan ng screw, pins, or wires in open reduction. You just basically realign. and the rest of the bone cells will do its function. So remember, si osteoclasts, si osteoblasts, hanggang maging osteocytes, or meron ulit mature bone cells. But it takes several months for healing to occur. Mas mabilis ang healing process pag sa bata because they have more active bone cells whenever there is damage to the bone. These are the common types of fractures. Comminuted, para bang nagkadurug-durug yung buto. Compression, no, na-crush. Depress, it's pressed inward. Impacted, no, they are forced into each other. Spiral, pag na-twist, o kaya green stick, nag-break siya pero incomplete, meaning merong part pa rin ng buto na buo. Usually, sa mga bata, green stick fracture. Now, after the broken bone is reduced, so ang treatment niya, di ba, reduction, meaning nag-realign ka. Kung closed fracture, yung physician's hand lang. Pero kapag open fracture, baka kailangan ng surgery or lalagyan nga ng mga screw or bakal. So, after reduction, it is immobilized by a cast or traction. This allows the healing process to begin. So, sa upper right picture is a cast, and in the lower right picture is a traction. So, whether closed or open fracture, kailangan ngang immobile lang ang buto for a long time kasi yung healing time should start. Healing time for a simple fracture is about 6 to 8 weeks, pero much longer for large bones and for bones of other people also kasi nga lesser circulation na. Second, rickets. Rickets is a disease of children in which the bones fail to calcify due to lack of calcium in the diet or lack of vitamin B needed to absorb calcium in the blood. Maraming makukuhang vitamin D sa milk, tsaka sa bread, and other foods na fortified with vitamin D. Most children also drink enough calcium-rich milk. However, meron ding mga infants na nanonurse ng mothers who become vitamin D deficient at posibleng magkaroon ng rickets. As a result, the bones soften and yung weight-bearing capability ng bones nawawala. So, yung legs ng mga batang may ganito, nagiging bowed legs. And again, we know that calcium helps strengthen the bones. Arthritis describes over 100 different inflammatory or degenerative diseases that damage the joints. Lahat ng arthritis, they have the same initial symptoms, and that's pain, stiffness, and swelling of the joint. Masakit, naninigas, at namamaga. Then, depending on the specific form, certain changes in the joint structure occur. First is osteoarthritis, OA. Second is rheumatoid arthritis, RA. And third is gouty arthritis, or gout. Let us first look at the normal joint. So in the upper leftmost photo, you can see there the bone structure. So ito ay, let's consider it as the right lower extremity. So yung bone na yon, yung nasa taas, that part is the distal epiphysis of the femur. And then the lower part of the bone, yun naman yung proximal epiphysis ng tibia and fibula. And then, when these joints united, yun yung kanyang, when these bones united, yun yung joint. The blue portion is the cartilage. So yun yung nagpe-prevent din ng friction whenever the bones move together with the synovial fluid na color pink. So both, because these are diarthroses or mga synovial joints, the cartilage and the synovial fluid helps makushion yung mga buto, especially when they move. And then there's the muscle attached yung tendon so that the muscle and the bone can move. And the synovial membrane, no, lining the synovial fluid. And lastly, yung bursa, it's the one producing the synovial fluid. In osteoarthritis now, it's a degenerative condition. Over the years, yung cartilage nagsosoften, they fray, and eventually it breaks down. So in the middle photo, makikita nyo, wala na yung cartilage. So both ends of the bone, nagdikit na sila. Affected joints may make a crunching noise or crepitus when they move, tumutunog na parang nagka-crack. Next is rheumatoid arthritis. Here, you can see that there is still cartilage. Meron lahat ng parts na nakikita natin, but the synovial membrane is swollen and inflamed. This is an inflammatory autoimmune condition wherein yung body's immune system, it mistakenly attempts to destroy its own tissues. Hence, nagkakaroon ng inflammation yung synovial membrane. Nagtithicken yung membrane, and then nagjo-joints yung swelling, no? The joints swell because the synovial fluid accumulates. And lastly, gout. This disease is a uric acid problem of metabolism. Yung uric acid, normal waste product siya ng nucleic acid metabolism. It accumulates in the blood, and then nade-deposit siya as crystals in the soft tissues of the joints. This leads to an agonizingly painful attack, and usually it affects the single joint, madalas sa great toe. So again, lahat itong mga arthritis na ito, they are inflammatory or degenerative, and minamanage siya, especially on the symptoms to control pain, stiffness, and swelling of the joints. That's the end of the lecture in skeletal system. Thank you very much.